It is time now for some trusted dental advice from the friends at Lifetime Dental Health. And we've all heard this before, you need to go see the dentist every 6 months, twice a year to maintain good oral health. What you may not realize is that if you don't have good oral health, the effects can ripple through the rest of your body. Dr. Richard Berry and Dr. Beth Love with Lifetime Dental Health are here with me with more. Welcome to both of you. Nice to have you here.
Very nice to be here.
Thank you.
It is so true, Beth, that what happens here goes through the rest of the body, isn't it? And we don't think about that.
No, most of us don't think about that, but it is very true. It can start with as simple as gum disease, and then the gum disease progresses into periodontal disease, and then this turns into inflammation. It affects our whole body.
Dr. Berry, why is it difficult, though, for some of your patients to understand that importance? Because maybe I feel fine, so I don't need to see you.
Well, it's interesting. Statistically, 85% of adults live with gum disease and they don't even know it.
Really?
And it's really an epidemic. Part of the problem is there's no pain associated with it. So
until it gets bad.
Until it gets bad, and so 50% of people don't even go to the dentist because they feel fine.
And it's not just gums. They're thinking, I don't have a sore tooth, I don't have a sore gum, so I don't need to go.
Exactly.
But you can, Dr. Love, you can see things in someone's mouth at an early stage before there's complications.
Absolutely. That's why it's so important that you see your dentist every 6 months and have your teeth cleaned and have them examined, because then we can find these things at an early stage and then we can do something about them.
Give me an example of what you might find that would really help if you found it at an early stage.
When we just find bleeding gums. It's just as simple as that. Sometimes people don't even know that they have bleeding gums until we do some of our testing, and then that gives us we do more tests after that to see how pervasive is it, and then what do we need to help eradicate that. And we walk our patients through different protocols to help them get the mouth as healthy as they can.
Well, Dr. Berry, what can periodontal disease lead to?
Well, periodontal disease is actually a bacterial infection, and it can spread to through your bloodstream, and it can cause an increase in incidence in heart disease, stroke, cardiovascular disease, and you can see on the chart preterm birth rate.
Really? I did not know that just by having sore gums like that can lead to these other issues.
It absolutely can.
Is that because the mouth is sort of a haven for bacteria?
It is. The mouth has so many forms of bacteria, and there's about 10 different bacteria that really cause the problems, which we'd like to talk about at another time about testing for that.
Dr. Love, is it hard to treat this then, especially if it's caught early?
If we catch it early, it's not very. It can be as simple as just getting on a better protocol for the patient, of having them come in at a tighter to see us at a tighter schedule, 3 months as opposed to 6 months, of getting them brushing with a certain type of a toothbrush, flossing daily, changing their technique. Then as the disease progresses, though, then we have to get into treatments that are a little bit more they take a little bit more time for the patient. And
surgery sometimes?
And surgery can certainly progress to that also, but we like to catch it early so that we don't have to go to that step.
Right. Dr. Berry, is it different sexes, different ages that periodontal disease will affect more?
Well, it can affect any adult.
Even not kids as much?
Not kids as much. It usually happens when you're in your 20s or 30s. And there's certain diseases that you'll find it worse. If you have diabetes, you have a higher incidence of periodontal disease as well.
Yeah, which kind of makes sense because those things are all tied together. What should people look for, Dr. Berry, in their own mouth so that they might be able to not necessarily self-diagnose, but know if they really need to come see you?
I think some of the common signs are, first of all, bleeding gums, because healthy gums don't bleed. Also, if you notice gum recession, that's another sign. Those are the two common signs.
And gum recession can lead to some sensitivity, which is, I think, a way that people kind of know.
It sure does.
Something's going on. And I know next week we're going to have a more in-depth conversation about this and what people can do, and some of, as you alluded to, Beth, that there are some other ways that people can keep it from happening, but also once it is happening, how you can make it better for folks. And I know you have some ideas to share. So it's a pleasure to have both of you here again. We'll keep brushing, floss those teeth. It really does work, doesn't it?
It does.
It sounds so easy. All you have to do is do it.
And go see your dentist.
Go see your dentist.
And your hygienist.
Yes.
Thank you both.
It's great to be here.